Welcome back. Let's bring you this now. Well, the closure of the Charlotte Maxeke Hospital, of course, has been creating quite a health crisis in Gauteng. The hospital obviously closed out back in April, if you remember, this due to a fire which broke out in the infrastructure. But meanwhile, when you see some organizations coming into this, cancer, namely the Cancer Association of South Africa, as well as Hospices, well, they're saying that they've been inundated with calls from desperate patients, as well as people in Gauteng who are saying that they are unable to receive their medication at this point. So to paint us just a picture of what's happening on the ground, I'm now joined by Hospice Palliative Care Advocacy Manager, Ms. Leigh Meinert. Well, Leigh, thank you for your time and good morning to you. Let's start with that picture, obviously being painted for us on the ground, just in terms of the frustration that most patients and people in Gauteng are going through due to this closure of the Charlotte Maxeke Hospital.
Indeed. Thank you, Tumelo. I think to state that it's a crisis now is not an exaggeration. People are increasingly concerned. They're increasingly stressed. Their treatment regimes are being compromised. And so hospices are feeling it now too. We work very closely with cancer. We're referring. We're trying to work as closely with provincial government as we can. But we're getting calls from desperate patients and family members. And you can imagine, on top of being sick and facing life-threatening illnesses, these people are now stressed as well. And it's pretty dire.
Yeah. And when we talk about the stress they're going through, we're talking here about them being unable to get their medication, them being unable to get treatment, obviously also for wound care, etc. So this is what's happening right now.
Absolutely. And so, we're delighted when people call hospices. People are often nervous to call hospices, and we encourage people to call hospices for anybody who is facing a life-threatening illness at the point of diagnosis. Hospice is not a place you come to give up or when you're at the very end of life. So we provide holistic support and we're delighted to be able to support.
Yeah.
But really, the cases that we're worried about right now are the non-malignant cases, and where people are just not getting the help that they need.
Yeah, and let's talk about that support for a moment, Leigh. What support do you give? You call it a more holistic, approach to the support. What support do you give as hospices?
So hospices are quite unique in that they put the patient and their families at the center. We obviously assist with the medical issues, be they pain management, wound care. 97% of hospice care is provided in people's homes. That's not understood. Home-based care is a huge aspect of the support we provide, and obviously that's something that we can help with during this crisis. But in addition to that, we employ social workers, we employ spiritual counselors, we have nurses and home-based carers, and it's really wraparound support. So the stress that people are feeling, the anxiety, the burden on families, these are things that hospices are well equipped to help with in a holistic way. But obviously it has to be a team effort.
Yeah.
During this crisis. Hospices are predominantly self-funded and have minimal resources and need support to rise to a challenge like this.
Right. And I assume when you talk about team effort here, you're also referring to government. How do you think they can play a role in better supporting you as organizations? You mentioned you're self-funded, you usually do so much of your work on your own goodwill, but how can they better support you?
Well, this crisis is really highlighting something we've been speaking about for a while, and that is that palliative care is just not funded in this country. And I describe palliative care as this holistic support for anyone who's facing a life-threatening illness at the point of diagnosis. It's a well-developed expertise, but it's not funded. Hospices don't receive state funding. It's not integrated into the way that hospitals work. We have a national plan and framework, but it just isn't being implemented because it isn't being resources. And then there are times like this when the health system is stressed, and we rarely see how much patients need this kind of support and just aren't getting it. So we really are calling on government to accelerate that plan, to put money into palliative care in this country so that people at the most vulnerable times of their lives get the support that they need.
Absolutely. And just briefly before I let you go then, I mean, you did say that you are being inundated with some of those calls from desperate patients and people in Gauteng. How can they contact you, and who is HPCA? What do you do? Just in case someone's wondering, when I call you, what kind of help will I be getting?
So I encourage people to go to our website, hpca.co.za. We're a national body representing nearly 100 hospices in every single province. As I said, our network is wide because we also offer home-based care, and there probably is a hospice near you. So there's a hospice finder on our website. You can find out more about our work. You can donate to our cause if you want to. But we are the leading member association for hospices, representing quality, helping to ensure that when people access a hospice, you're accessing the very best care and support that you possibly could.
All right, Leigh, that's where we leave it, but thank you so much for joining us. Leigh Meinert, of course, the Hospice Palliative Care Advocacy Manager. They're talking to us on a rather important conversation.